It has been called the biggest health crisis you've never heard of. As many as 2.5 billion people around the globe are estimated to need glasses, but don't have them. In the sleepy town of Karyapati, India, dozens of people receive eye care each day at the Vision Center clinic. But many people in the country, as many as 220 million, don't have access to these kinds of facilities and can't afford glasses.
I'm Shivang, co-founder of Optica. We've made the Quicksee. It's a tool that allows you to provide an accurate eye exam anywhere, so that people who sell and prescribe glasses can reach the patients who need them most.
Shivang Dave is CEO and co-founder of Optica, the developer of Quicksee. He was representing one of 10 teams of social entrepreneurs competing in Washington, D.C. at ASME's Innovation Showcase, or iShow, one of 3 such events held each year, with competitions also held in Nairobi, Kenya, and Bangalore, India.
It's a handheld, easy to use, you basically look into for 10 seconds, you push a button, and at the end of that 10-second reading, it gives you a very accurate measurement of your eyeglass prescription.
We're giving sort of the gift and opportunity to access education and other basic resources that we take for granted for people with clear vision. And we're giving that to people who just don't have that access right now.
As a winner at iShow 2017, Optica received design and engineering guidance, along with grants totaling $28,000, which Shivang says have been major factors in Optica's success.
Hi Shivang.
Good to see you. Thanks for
having us.
Today, they work with vision care providers in low-resource settings around the world to study Quicksee's usability and accuracy against standard equipment used to measure vision.
We did our first large-scale clinical study. We did it here in India at Aravind Eye Hospital. What we were able to show was that the device was remarkably accurate. At that point, we really knew we had something that could have a lot of impact.
It's in rural areas like Odanchatram, where there are few eye care professionals, that Quicksee could have the greatest impact. Once a year, Aravind turns a wedding hall there into an eye clinic. In this single day, a staggering 700 people received eye exams. This woman came because she could no longer read small letters. Technicians using Quicksee quickly determined the right prescription. She was among many people that day whose quality of life would improve radically with glasses.
The hopes of today are the relations of tomorrow.
It's not only in low-resource countries that Quicksee can make a difference. Some 9,500 miles away in Lubbock, Texas, optometrist Garrett Wentz also believes in Quicksee's potential to change lives. Dr. Wentz and his brother, Tucker, set up a clinic twice a month at a community outreach ministry that provides eye care services to residents who cannot afford it, like Rebecca.
I was in dire need. It was so bad that I couldn't even go down the street and read the street signs. It was really bad.
Quicksee helps Dr. Wentz see more patients, while Tucker makes the lenses.
When he gave me the glasses, I kind of was a little nervous, so I put them on and looked at the window, and I had to quickly take them off because it was so overwhelming. And I kind of started crying a little bit, and then he said, no, go ahead, put them back on and look out the window. And so I did. It was amazing. I did cry, as embarrassing as that is. I can see, it's really awesome.
Taking Quicksee on the road is a life mission for Dr. Wentz and Tucker.
I came across this device, the Quicksee device, and I was like, man, this is awesome. It's very accurate, it's portable, quick, easy to use. This is a no-brainer. I knew that one day Tucker and I want to take this on the road into a mobile clinic and be able to service people where they're at.
Back in Madurai, India, one of the founding members of the Aravind eye care system sees the Quicksee technology as a game changer.
It's going to play a very, very paradigm-shifting role in being able to reach the billion people who need refractive services, and many of whom live in developing countries where without a technology like this just wouldn't be possible.
We've been so grateful to ASME over the years because their help, their advice, their financial support has all come at critical times for Optica. It's one of the most impactful organizations that we've ever been lucky enough to work with and partner with. Some of the prize money that we won went into building early prototypes so that we could do pilots with external partners, and that was really critical to validate the technology in someone else's hands and then, get the ball rolling even further towards manufacturing. You asked me what my dream is, millions of people being auto-refracted with this in the future and helping them get access to eye care when they didn't. No one's going to solve such a big problem by themselves, but I think we'll be one of the people who participate in putting a dent in it.